In July, we reported about a 35-year-old man who contracted typhus from a single flea bite, which sent him to the hospital. 1 month later, he lost his hands and toes. In tonight's Wear the Gown, KENS 5 reporter Jeremy Baker looks at insect-borne illnesses in South Texas.
There are a couple of factors leading to the increased numbers of diagnoses and the awareness of insect-borne illnesses from insects like fleas. One could have to do with a warming climate.
With increased warmth across the globe, there's going to be increased tolerance for some of these infections, and there's going to be shifting or moving of some of these vectors, these insects that transmit these infections.
Dr. Jason Bowling, the chief epidemiologist at University Health and professor of infectious diseases with UT Health San Antonio, says increased awareness and more testing is a second factor.
They're testing more. And so as we test more, we find some in places where we might not have thought to look before.
Mosquitoes are a big problem too. Researchers tracked the impact of warmer weather from 1979 to 2022 and found 71% of the U.S. saw a 16-day increase in the length of the mosquito season. For those that contract West Nile from mosquitoes, most will not develop symptoms, but about 20% will develop a fever, headache, body aches, and a skin rash, but will recover quickly. Dr. Bowling says to reduce your risk of contracting West Nile, you need to practice mosquito abatement.
Water around, a dish with plants in it, water in bowls outside can serve as reservoirs for mosquitoes to breed and increase in number around your house. Wearing insect repellent.
For more information from Dr. Bowling about these illnesses and the Zika virus, check out this story on KENS5.com. Jeremy Baker, KENS 5.